Welcome to the channel Health, Balance, Well-Being, your oasis of peace. Have you ever heard a clicking or snapping sound coming from your body when you move a joint? Maybe while you rotate your head, bend your knees, or simply move your fingers. This is a fairly common experience, but what perhaps not everyone knows is that there is no single explanation that is valid for all cases. In fact, each type of joint crackling has different and specific causes, which depend greatly on the context in which it occurs and the type of joint involved. This phenomenon, sometimes curious, sometimes worrying, can have many interpretations. To better understand what it is useful to distinguish between the various types of joint noises. Furthermore, it will be interesting to explore the reasons why some people feel the need to crack their joints, what actually happens during a manipulation performed by a professional such as a physiotherapist, and above all, to understand if and when these sounds should be a cause for concern. Before going on, I ask you for a like to support our work. But let's get back to the video. Joint cracking, a widespread and often harmless phenomenon. Many people remember cracking their knuckles as children, sometimes for fun, other times out of habit or to relieve a feeling of tension. This type of cracking is in most cases completely harmless. Even in adulthood, and even in old age, it can happen to hear these sounds, especially when performing stretching exercises or gentle gymnastics that bring the joints to their maximum extension. These popping sounds, technically, occur when joints are stretched rapidly. Inside the joints, especially the synovial joints, there is a lubricating fluid that, during movement, can form gas bubbles. When these bubbles collapse or burst, they produce the typical dry sound. There is nothing pathological about this, it is simply a natural physical reaction of our body. Other types of joint noises. However, there are other types of joint sounds that deserve further investigation. The second type is linked to degenerative phenomena, such as osteoarthritis. In this case, the sounds tend to be less dry and deeper, and are often accompanied by a sensation of friction. These noises are generated by damaged joint surfaces that rub together, often due to the loss of cartilage. Although this can be worrying, the noise is not always an indication of clinical worsening. In fact, many elderly people live with mild or moderate forms of osteoarthritis without experiencing pain or particular limitations. A third type of noise comes from the rubbing between tendons, muscles, or ligaments that, during movement, change position and then quickly return to their original place. This type of crunching can occur in different areas of the body, such as the knee or jaw. Again, there is often no cause for alarm, especially if it is not accompanied by pain. When to worry and when not to. At this point, a question arises spontaneously: are these joint noises to be avoided? Can they be dangerous? The answer depends on the cause and the specific situation. If they are self-induced cracking, that is, produced voluntarily by bringing a joint to its limit of movement, there is nothing to worry about. On the contrary, this practice can also be beneficial, as it allows you to keep your joints mobile and flexible. However, it is important to pay attention to the context. If you feel the constant need to crack your joints to get relief, this could be a sign of another problem, such as muscle tension or stress. Spending many hours in the same position, for example for work or study, can create stiffness and the need to release tension. In these cases, the sound is not the problem, but the symptom of an underlying condition that should be addressed, perhaps with the help of a mental health professional or through relaxation and stress management techniques. The case of osteoarthritis and joint injuries. Many people begin to worry seriously when, following joint pain, they receive a diagnosis such as starting osteoarthritis. It is understandable that the thought of a worn-out joint makes one fear for one's future mobility. But today we know that joint degeneration is a physiological phenomenon that accompanies aging, and that many people live with osteoarthritis without showing disabling symptoms. Studies and research confirm that if we subjected everyone over 60 to an MRI, we would find many signs of joint wear. But this does not necessarily imply pain or loss of functionality. So, if you do not have constant pain or serious limitations, there is no reason to be alarmed by a simple creaking. Therapeutic manipulations, do they really work? Another aspect to be explored concerns the manipulations performed by professionals such as physiotherapists, chiropractors, or osteopaths. Some of them practice techniques that deliberately produce a joint popping. These maneuvers are often presented as a way to realign the joints or correct malpositions. However, numerous scientific studies have questioned the effectiveness of these techniques. As early as 1996, a well-known Australian physiotherapist conducted an experiment in which he demonstrated how the benefit of a manipulation was largely linked to the placebo effect. When a patient believes that he has been treated effectively, he often reports a subjective improvement, even if there has been no real physiological change. This explains why many people report temporary benefits after a manipulation, but then have to return regularly to repeat the treatment. In light of this evidence, many experts today recommend avoiding systematic joint manipulations, because not only do they not provide lasting benefits, but in some cases they can even cause permanent damage. The safest and most scientifically valid approach is one that focuses on active movement, stretching, and muscle strengthening. In conclusion, if you hear joint sounds when you move, there is no reason to worry in the vast majority of cases. If you make the clicking sound yourself because it gives you a feeling of relief, it could be a sign of accumulated stress, but it is not dangerous anyway. If the noise is associated with pain or a recent trauma, it is always a good idea to have a medical evaluation to rule out injuries. Remember that the human body is designed to move and adapt. Even in the presence of structural changes such as osteoarthritis, maintaining constant and calibrated physical activity is one of the best ways to preserve joint health. The important thing is not to be guided by the fear of noise, but rather to use it as a stimulus to take care of yourself in a more conscious way. Remember that this video is created for informational purposes and should not replace your doctor. If you have any questions, contact your doctor. If you like our videos, leave a like, subscribe to the channel to not miss the next contents. See you in the next video.